You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
A primary rhinoplasty surgery usually takes me about 2 hours from the beginning to the end. And most of the time, I finish in an hour and 45 minutes. Rarely, it may take 2 hours, 15 minutes. I see the patients for a follow-up the next day, whether they're out of town or in town, for a variety of reasons. And the in-town patients, I see them in a week after that, will be 8 days to take the bandages off. The out-of-town patients, they take their bandages of 7-8 days, and we set up a virtual consultation. I see them also, but virtually. And also then I see the patients a month after, and if everything is okay, then close to a year after the surgery. But if I have any questions, concerns, I may see them as frequently as I need it to make sure that the patient is healing fine. Most patients, whether they undergo closed or open rhinoplasty, will recover socially, can resume their social activities within 8 to 10 days. And a couple of days of earlier or later recovery is not going to be consequential over the long-term follow-up. So we have to really be focused on what the nose is going to be looking a year later, 5 years later. And because of that, again, to choose one technique over is not really justifiable. But most patients recover within essentially the same time frame in terms of being able to go back to work or resuming their social calendar. There's actually the phases of recovery for every rhinoplasty patient. And we try to control that to the best of our capabilities. There's going to be some swelling, some bruising in the early stages, which within the first 2 days may get worse in the first 48 hours, and they start getting better. But those of us who are experienced use some medications during the surgery to control that magnitude of swelling and bruising during the surgery. And I usually can do that, actually. As soon as I open the nose, I know what is that I'm dealing with and use medications to moderate that course of swelling and bruising. And that bruising and swelling is going to be about 7-8 days. And most patients during that period of time are going to have a nose splint to control the frame and 2 internal tubes that majority of us use helps the septum, the partition in the middle of the nose, to heal in the proper position. And those tubes will come out first in about 7-8 days, and the splint will be removed. And I have streamlined in such a way that majority of my patients from out of town and out of country can actually go back home the next day, and they remove the bandages. And 99.9% of my patients can do that. And if they're not comfortable doing that, we arrange for them to have the bandages removed. Beyond that, again, they will refrain from strenuous activities, avoid extraneous activities, heavy exercises, playing tennis, jogging, swimming for 3 weeks, and gradually get back to normal activities. In 3 weeks, they can do whatever they want to, except for wearing glasses over the nose frame without some support. Meaning there should be some support on the bones so that the glasses would not squeeze the bones together for 5 weeks. Thereafter, there's no limitation. They can resume everything that they do. And it usually takes about a year for most noses to look the way we're hoping that they're going to look, meaning healed and for the swelling to go away. But the initial swelling, the major part, would be gone, as I mentioned, in 7-8 days. And for some noses that are really thick, have thicker skin, the nose may take as long as 2 or 3 years to assume the shape that is going to ultimately assume. If anyone is interested in a rhinoplasty consultation, you can call our clinic, Ziba Clinic, 440-461-7999. Again, 440-461-7999. Or you can go to my website, drbahmanguyuron.com, and you can actually make your appointment through the internet. We're here to serve the patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.